Yeah, so Monique, she joined Farm Access in 2008, and she actually has a remarkable achievement because the Medical Credit Fund was last year awarded the prize for innovative financing at the G20 SME Challenge, which is a very, very great achievement. But then, on the other hand, nothing has come out of this prize. We don't know yet how this prize, but we are heavily working on it. So that is to reassure the whole thing. So I think that's it.
That's it. Okay, Monique, you know you have...
I know.
Okay.
Good afternoon, everyone. It is speed over precision at this moment with this presentation. I hope you can bear with me. So, welcome everyone. Thank you for being here. My presentation is about the Medical Credit Fund. Michiel kindly gave also already an overview, so therefore that helps me move along a little bit faster to catch up some time. The Medical Credit Fund is all about financing healthcare quality improvement in Africa. Just to quickly grasp back on the slide that Michiel already presented to you, the red circle, the Medical Credit Fund strengthens the supply side through access to finance. Why is that so important? The majority of the private healthcare providers in Africa have no access to capital, not at all. And this, despite the fact that 50% of this care is delivered by private providers. This morning earlier, we saw how scarce the capital is. Less than 1% of the world health spending for a continent which bears 44% of the communicable diseases and is home to 13% of the world community. Also, government facilities are largely underfunded. So there's a really overall scarcity of finance for healthcare providers in Africa, which leads to low financial capacity on assets, process and skills. It leads to low medical quality of care, also on the assets, process and skills. And this all results in a low willingness to prepay, which in the previous presentations we have seen is so important in order to be able to help up insurance schemes, whether they're private or national. So what are the reasons for this scarcity of capital? I'd like to distinguish them in two categories, financial and medical. Financial is because doctors were trained to be doctors, not businessmen. So often they are very financially illiterate. They have a very weak way of planning and managing their financial administration, if there is any. There's limited collateral, there's no credit history. And of course, because of the social function of the nature of their business, there's a difficult enforcement of loan contracts. On the medical side, it is difficult to judge how a healthcare provider performs. There are no clear medical standards. There's no management and measurement of medical quality, and it's difficult to compare them. So basically, the whole sector is faced with unknown risks, and no investments are taking place in the supply side. If they are available at only very, very high market rates. We heard the discussion about this morning. What we see is when we speak to doctors, if they were able to talk to banks, they were faced with 25% or even more, let alone not even talking about all the fees that were to come after that. Donors, when they invest in private companies, private healthcare companies, they don't know to be sure whether it's really spent on medical improvements. Will it actually lead to improved quality of care? So there's no investments to grow the business, to purchase equipment, or to train staff. This is the main reason why Farm Access in 2009 decided to start the Medical Credit Fund, to help those facilities to access affordable loans in order to increase the access to quality healthcare. When we started the Medical Credit Fund, we had to decide on which market segment we would aim, and this was quickly clear. When you look at the market and you distinguish them in terms of large, mid-sized hospitals, health centers and dispensaries, it is very obvious that the highest need is in the area where also the risk is highest. This, of course, presented us with a quite complicated and challenging business case on one hand, because the transaction costs are high and the number of facilities we needed to cover are much higher, and the number of the loan amount that they need is so much lower. And we all know the lower the amount of the loan doesn't mean that the cost to provide them is also lower. In fact, most of the time it's higher. Despite that, the Medical Credit Fund focuses on the primary healthcare facilities. So the facilities that provide the first level of care to low-income groups. So how is the Medical Credit Fund organized? It are basically two interlinked programs to tackle both these issues on the medical side and on the financial side. And those interlinked programs are closely implemented together with local partners. There's the Access to Finance program, and there is a very comprehensive technical assistance program, both on quality and business. These programs are implemented with our local partners. We have partnerships with local banks in each of the countries where we work, and they are the ones providing the loans to the doctor. We do not do that ourselves. We work through those banks in order to catalyze the market function and get the banks to know the healthcare market and the healthcare providers. The whole technical assistance program is also implemented by our local partners in Africa, in each of the countries. Normally we work with associations of private healthcare facilities and umbrella organizations because they are close to the ultimate customers. They know the business. They are our eyes and ears on the ground. So they work closely with the private healthcare providers. So what is the technical assistance program? It's all basically about risk reduction, risk management, and performance. So at clinic level, the first thing that we work on with the clinic is a basic introduction to training on business planning. The doctors are literally lining up for these businesses. We all know that providing training in Africa, often people attending that, they would like to have their per diem to pay to be able to sit in a training. These doctors are actually willing to pay for those training. They don't ask to be charged to receive a refund for their travel costs. They are really happy to receive this training because it's very valuable for them. They are running a business. The team on the ground helps them with the preparation of financial statements and in support of writing very simple business plans just to get the basics to understand what they will be able to borrow and what they can use it on. They need support with filing of the loan application, and we are also working towards having them a certificate on their business performance. This part is very important on the side of the banks to be able to increase trust and to reduce risk, and also for us as a fund to know in which facilities we are investing. But also it's very important on the side of the clinic. One of the reasons clinics and banks don't meet is also because the clinics are very worried about getting over-indebted, not being able to repay their loans. And the nature of their business is not that they want to make money. No, they want to serve the community where they are, and they're there to stay. So they want to grow their business, but they just don't know how to. Very important part also of the technical assistance program is that we would like to couple the loan provision to really measurement of quality improvement. That is why we work closely together with Farm Access, and the Safe Care Initiative has completely been embedded in the program. Tobias will come back about the Safe Care Initiative a little later. But basically, this provides the clinics and ourselves the opportunity to be assessed at the beginning. Where is their current level of quality of care? Where should they be investing in? What is their weaknesses and what are their strengths? And also, how do we measure them over time? So this provides you just with an idea of also the information that is fed back to the clinics. And also one of the things that the doctors said to us, we have been rated, we have been inspected, but we never heard how we actually performed so that we could use this information to really know what to improve. So this is another very important part that is interlinked in the Medical Credit Fund program. Then, of course, the last part, the piece, what it's all about is actually get them to access to credit. We also provide some capacity building at the level of the bank to get a better understanding of the healthcare sector, that you cannot judge it just from a balance sheet or the profit and loss, but you have to look at the cash flows. Also to get them a better understanding of the healthcare sector. Then we provide small loans at affordable terms in local currency, and that is also a very important point for the facilities. We start with lending very small amounts just to do some first quick fixings, then moving gradually into larger loan amounts. Over that time, trust is built and the risk is reduced and the relationship with the bank is built. And the healthcare facility has the ability to build up a track record. The program with the bank has been set up such that initially the Medical Credit Fund takes the majority part of the risk. in a risk-sharing agreement. And over time, the risk is shifted from the medical credit fund to the bank, after which we exit. This is just a little example of Mission Mbagala, a small dispensary in Dar es Salaam in Tanzania. Dr. John was actually the first doctor to receive a loan through the medical credit fund just a year ago. So far, he has been totally on schedule with repaying his loan. He borrowed $16,000 to invest in renovations, a new generator, and some new lab equipment. He repartitioned the place, and now already, within a year's time, he has seen 15 to 20% more patients, and very interesting, patients that are capable of paying a little bit more, so that the way many of those doctors work, he has a better ability to cross-subsidize the really low-income patients or some of the patients that cannot afford to pay at all. Now he is facing new demands, so he is speeding up the repayment of his first loan, and we're actually in discussions with him about his second loan, for which he would like to buy an ultrasound machine. And I think that here above is some of the first, and the place really looks so much better. It has completely been retiled, so hygiene has gone up, and also the way he can handle his patients is the flow of patients has increased a lot, and he has been able to provide many more services. So how are we financed? The capital structure from the MCF is what we call a hybrid model. Because of this comprehensive technical assistance program, and because of the risk part that we take and the loans that we provide in local currency, we are financed through a mix of grants and investment capital. We are currently in the process of raising up to 27 million by blending different sources of funding. As you can see, we will have 4 different types of funding: public capital, public grants, and private capital and private grants. Very important point for us has been, and I wish that Nano Kleiter was still here, has been able to raise the money for the first loss facility, the cushion on which we were able to leverage capital from private investors. And I can tell you it has been a challenge. And I think that if it not were for the G20 award, it would have been much more difficult, because this really brought us to the table. Our aim is to provide over 3,000 loans during the next 7 years. And frankly speaking, as we see the ways are going now, it may be many more. So far, we have OPIC willing to finance us. Our first loan of $5.5 million has been approved. OPIC is the development bank of the United States. The Dutch government is actually the ones that are going to finance the first loss facility. And we are currently negotiating with the G20 fund for some finance. And USAID is also stepping in on the first loss facility. On the private side, we have been fortunate to have some private grants from Dutch philanthropists, which made it all possible for us to start initially. And then there is investors like Calvert Foundation, Soros Economic Development Fund, and Deutsche Bank, who have committed to participate in the medical credit fund. And here is something, just to get back on what we discussed this morning, is how can we achieve more with less dollars? That is also one of the aims that we have. By providing these loans in combination with technical assistance, with a smaller amount of public funding, we can revolve this and leverage it into much more. So for the public parties that are participating in the medical credit fund, their $13 million will over time have increased the access to capital to $65 million in the market. So the impact: the MCF strengthens local healthcare providers and the overall systems for accessing finance and enhancing quality. We focus on a financial return, a medical return, and a social return. The financial return, that we prove that those clinics are financeable and that we can scale access to finance and that they will repay their loans. And also, we will repay our investors. We're not looking at the interest rates, which Max told you about. The interest that we provide to our investors is between 3% and 5%. The medical credit fund is not for profit. So therefore, we also very much focus on the medical and the social returns that we have. That the investments will lead to measurement quality improvement. So a clinic can only get a follow-up loan if they have managed to show significant improvement in their quality of care. Also, the social capital part is important. And by working with those local partners, it is very important to build capacity with them to work with the clinics and for the patients at the end of the day, and that's what it's all about. They will have access to better quality care and more services at an affordable cost. So where are we now? Well, we all know about the prize. That really helped us a lot. In the meantime, we have partnerships established with banks and TA partners in Tanzania, Kenya, and Ghana, where 50 staff have been recruited and trained. And as a matter of fact, last Wednesday, a few of us were in Kenya to participate in the launch of the Medical Credit Fund and Safe Care Program with our partner, KMET. Monica Ogutu is here. And it was wonderful to see, because there already 25 of the providers have accessed loans, and they were all present, and I can tell you it was a party, really. And it was interesting to see and to hear all their discussions. So far, we have 55 loans disbursed and a portfolio of a little over $500,000 currently outstanding, and the pipeline is filled. And that was why I would like to finalize my presentation. We are really embarking on something that can be big, and it's not because what we do, but because the problem is so big, and the access to finance and to improve quality of care is so important. Thank you very much.